gives you a very warm welcome.
Thomas Pane, plastic surgeon.
It is very good to see you here, Dr. Pane. Thank you so much for spending this time with us. As we know, you have a very busy schedule today, so we're going to make this as short as possible, but we just wanted to ask you a few questions. Starting off with a little background and a little more personal. Where are you from?
Originally from Connecticut.
Cool. And when did you move to Miami?
I came to South Florida around 2006.
Oh, wow. Okay.
So, yeah.
Time ago. And what made you choose to come to Miami?
Well, actually, I was in South Florida already practicing. And at that time, Miami was really growing up even more with cosmetic surgery. And I knew some of the other doctors in the area. And as the centers were looking for help, my name got mentioned, and I got a call, and here I am.
Amazing. I do always say that we are like the capital or the hub of plastic surgery. Do you kind of agree with that?
Yeah, definitely. And, I think a lot of the things that we do here are, innovative, but like I said, we always want to, keep on top of the right techniques and things, how to do things so that we get positive results and, make it good for everyone.
Absolutely. You want to keep it safe and good for everyone. And okay. What is one reason you decided to become a plastic surgeon in the first place?
Plastic surgery, the good thing about it, if you look at like how surgical fields develop, a lot of them over time, they winnow down to doing a fairly small number of things. And plastic surgery is different in that it's pretty general in terms of it contacts a lot of different areas. So what attracted me was the variety and the fact that you could use some creativity with a lot of the different procedures. And it kind of matches what I've always liked to do.
Amazing. Thank you so much. And what is one of your most requested procedures?
I probably get requested a lot to do the mommy makeovers. Mm-hmm. They are a little bit longer. They can be a little bit higher risk and things like that. And I've got the technique down pretty well, depending on what we're doing. Breasts, there's a lot of different things that can be done combined with the tummy, and I managed to keep the procedure time short enough where it makes it a safer procedure. So I think a lot of times those people will take a look and see the results, and they'll maybe see a friend or whichever, or they'll talk with the coordinator, and then my name gets mentioned. That's one of the big ones.
I did hear that yesterday. Yeah, we were speaking with one of our testimonials, and they were referred to you by their sister. So we do hear that a lot with you.
Yeah, that's good.
To piggyback off that question, what is a mommy makeover, and how do you get that time down, or what is the time?
Yeah, basically a mommy makeover is, some kind of breast procedure combined with some kind of tummy procedure. Most commonly, it's like a breast lift or a breast aug and a tummy tuck. It can be a breast augmentation with lift. It can be a breast reduction. And, the tummy tuck can be, a standard tummy tuck, a real extended one, or even the inverted T type procedure. So that's the most common way. Basically some kind of breast procedure with some kind of tummy procedure. What I do is I work with assistants that can help me close the skin. So when I'm finishing one area, they're closing the skin in one area, then I'm on the other part, and then we kind of go like that. So there's that overlap, and it does reduce the time. Probably takes about 3 hours, maybe 2.5, depending. And if a person has a higher BMI, there's a little more area to cover, so it takes a little bit longer. But in general, I try to keep that, the procedure around that time.
And this is why we go live with our plastic surgeons, because you really get the background and the grit and the grind behind what happens here. I did not know that about the time frame and all such. So thank you for that. And what are some of your favorite procedures to perform?
Well, I do pretty much almost everything in terms of what you can do in cosmetic surgery that can be done as an outpatient. Like I say, my favorite procedure is the one I'm currently working on because I want to be focused in on that and only that. Mm-hmm. I actually do like the breast and body work quite a bit. Mm-hmm. I also like some of the unusual things. I do standard face procedures. Not 100% we offer here, it depends on the situation. But I also like procedures that are a little unusual. Maybe there's been something, it's an unusual request or something's happened before, maybe like a secondary procedure. A lot of the things that sometimes get turned down, I actually want to hear about. So because I've had a lot of that over the years, where we've gotten good results from things that maybe no one else would look at it, or maybe the person had medical problems, stuff like that. So I kind of built a little bit of a niche doing that kind of work.
Awesome. So if you have a procedure that other doctors may have turned down because they're not sure if they can handle it, definitely reach out and get a consultation with Dr. Pane, because he will check you over and see if it's something he can do for sure. And now we're going to ask some common asked questions just around the plastic surgery community. And what is the general recovery time for a single procedure and a multiple procedure?
Yeah, in general, what I do does not require real long recoveries. I tell people plan on pretty much a week out of work in most cases. People that have telephone and computer type jobs, especially if they're self-employed, say they're lawyers or accountants, something like that, they might want to be back on the phone, even the next day or something. And they can do that if they're not doing anything physical. If you're doing physical stuff, depending on the kind of procedure, you got to take a time before you're actually going to do real heavy physical work. So sometimes the recovery can be longer for them. They could go back to light duty though, perhaps in as early as the second week. That would be most common for most of the procedures. And a multiple procedure, it just takes a little bit longer to recover from, but it doesn't necessarily mean it's a much bigger recovery, because sometimes, like for example, let's say it's a breast lift alone. A lot of times that part of the procedure isn't even sore. The tummy tuck might be the more sore procedure. So it may not really add a lot of time to it. But in general, if it's a combo procedure, maybe into that second week is probably a safe estimate.
Amazing. And how long after cosmetic surgery do you have to wait before getting more cosmetic surgery?
Yeah, that's a good one, because that question depends on what we're talking about. In general, our anesthesiologists don't want anyone going under a second general anesthetic inside of 1 month. So if you're doing something in a different area, let's say, I'll just make it up, we'll say somebody's going to have a facelift and then they want to come back and have a tummy tuck. You could do that as early as, even a couple of weeks later. Most people probably would wait longer, but we wouldn't want to put you under 2 general anesthetics inside about a month for elective purposes. And if something's being done in the same area, let's say, somebody's getting abdominal lipo and then later they decide they want to have them even flatter, you got to wait a while just to see what the final results are. And because it's in the same area, you got to let all that scar tissue soften down. So in that case, it's usually about 6 months. Mm-hmm. But for routine things that are, say, a different area, over 1 month, typically we tell people about 6 weeks to 3 months is safe to space things out. Just want to make sure, depending on what kind of procedure it was. So if it was a big lipo or something and the hemoglobin comes down a little bit, we want to give you time to recover on that. In general, you want to space it out a little bit.
Amazing. Thank you so much. And last question that we have for you today is, we're going back to the mommy makeover, and how long after a mom having a baby do they have to wait before they can get this procedure done?
I usually tell people it's not good to do it under about 3 months. Mm-hmm. I think the earliest it's probably possible to be about 6 weeks. You want your body to kind of come back to the baseline. You want to be through the stress of childbirth and everything. Because again, we shouldn't take it lightly. It's still a major medical event, to have a baby, even though most of the time it goes completely fine. So 3 months is probably the best time minimum. But I usually would tell people, if they're in no hurry, wait a good 6 months, because there's slight increased risk of particular complications that can come on if you're doing, a mommy makeover in a very short time after a significant medical event like having a child. So you want to wait a little bit, especially if it's been a C-section, for example. So that one's a minimum of 3 months there, but 6 is probably better.
Amazing. Thank you so much for all of your time. We really appreciate it. We know you have a very busy day getting back to all of your patients. So thank you again, and we hope to see you soon.
All right, take care. I'm not clear. So it was like looking at you, looking at there. I'm like trying to figure